So I thought I would start out with the hospital story. The story that everybody saw, um, everyone kind of knows a little bit about, but not really. I posted pictures of me in the hospital, but nobody really understood what the heck was going on. People didn't link it to lupus. I mean, it, it's a it's a big story. It's a complicated story. So I first wanted just to kind of put it out there what happened. And I'm not going to go into great details of how it kind of led up to it because it doesn't matter at this point. Because first thing I learned in therapy was the past is the past. We can't change it, but we can change the present. So we'll say at the point up till I had a perforated ulcer, I was dealing with a lot of stressors in my life. A lot. And they were internally stressful. So when I say that, you may not physically see, a rash, or, I may not be crying, but was internally struggling with a lot of stressors in my life in a lot of different situations. A lot of choices to make. I'm 30, I'm young, and I'm sitting in this exact room. Actually, I was cleaning it because my husband it drives him nuts, this room with all my clothes. And I remember getting this pain, and it was right under my rib cage, and it was the most bizarre. I'm like, oh, I must have heartburn, right? Chug half a bottle of antacid, and it becomes just throbbing. And I remember sitting in my chair just going, this is just weird, thinking it's going to pass, it's going to pass. I get to the door, and I realize this is worse than this is worse than birth. I birthed a child. I've never felt anything like this. I get to the bottom of the stairs and I start screaming for my husband. Now my husband loves me. Don't get me wrong, but I can be dramatic. I'm not doubting that. I won Queen of Most Dramatic in high school. I'm sure he thinks that I stubbed a toe or something. Probably after the 6th time he comes down the stairs and he's like, what are you doing? I'm laying on the ground and I'm twisting and torching and just screaming and saying, I don't know what's wrong. And it was the pain that was under my diaphragm, and it was moving. It was a moving pain. It felt like a liquid was slushing around in my stomach, and I had no control over it. But the pain, I had kidney stones 6 months pregnant. Okay, that's painful, right? This was breathtaking. I couldn't take a breath. I couldn't move. I couldn't sit. Any angle was horrific. And he just looked at me and he said, well, what do I do? Do I call your mom? And at that point, I didn't want to stress my mom out. No, don't call my mom. And what do we do with this, Tim? We start Googling. Dumbest thing we could do, I know. My husband is the worst, and we're trying to break him up because Google is not my friend, because it will tell you 10 million ways I'm going to die. It was an ongoing joke for a while. But my husband, that's his way of coping, is just kind of trying to Google things. So, he's like, well, where is it? Could it be a gallstone? Could it be this, and I'm like, I don't effing know, At this point, I can barely get words out other than screaming. My daughter comes down. Are you okay, Mama? She's 4.5. And I remember just gritting through my teeth, Mama's fine. Mommy's just in a little bit of pain. And I remember looking at my husband, Luke, and saying, get her upstairs. Lock her in her room with her iPad now. It was that scary to me. And the pain wasn't stopping at all. And, he just said, well, we can call your mom and I can take you to the doctor. And I just said, I don't think I'm going to be able to sit up. There's no way I'm going to be able to get in a car. The pain was so intense. It was cold sweats. I had just never felt anything like it. And I felt like I didn't even have control over my own torso. It felt like The Exorcist, where your body is, like flexing and all this stuff. It just was so bizarre. And And so at one point, I looked at him and I just said, you have to call 911. There's nothing, we have to. At that point, I literally thought that I was dying. The pain had started to go into my shoulders and into my arms. And so I was thinking, I'm 30 and I'm having a heart attack. And I hadn't voiced that to Luke because he's our biggest worrier. So I'm still laying at the bottom of my stairs. And we live in a split level. And so he's talking to the people on 911, and I can hear them, and he's just saying, I don't know what's wrong with her. She's, in so much pain. And I remember banging on my wall, just going, oh my, just, that's all I could do was scream. And he just kept saying, I don't know, and I could hear them talking to him, and he said, I don't think I have any aspirin. I don't know. She's sweating, but, she's awake. And, I don't think he even knew what to think. I mean, what do you tell somebody when there's nothing to really tell her than she's in pain and she won't move? The fire truck showed up first, I believe, and the police, and they couldn't, they were like, who is this 30-year-old, who's laying at the bottom of the stairs screaming like a fit? No, I've never experienced this pain in my life. They're asking me every situation possible, and I tell them I have lupus. I have an autoimmune disease. I take 1 million meds a day, but nothing's changed. And this came out of the blue. I didn't, they thought I'd injured myself. No, I was sitting on the couch. I hadn't moved a certain way and eaten anything different. It literally just, boom, came on. And they just seemed surprised, like, her vitals are doing pretty well, and so I couldn't do anything but continue to scream and, cold sweats. So they decided to bring me in. I got my phone. I just said, give me my phone. By that time, Luke had gotten home my mother, who lives 5 minutes away, to watch our daughter. And he was going to follow us in the ambulance. And I remember them saying, you have to go up the flight of stairs to get onto the gurney. And I remember at that time, the pain was kind of wavering. And I pulled myself up and I felt the pain. It was almost like liquid pain, right? It rushed down and I thought, oh my God. I felt like, okay, did my husband poison me? What's going on? I lay on the gurney and I don't care, at this point they're trying to buckle me and I'm like, I don't care. And my mom walking up, and I remember just feeling so guilty because how many times has she done this? I had to, rush, and she just looked at me and I just said, it's bad. They put me in the ambulance and, standard questions, there was no lights. It wasn't emergency. They thought I was constipated, to be honest with you. When was your last bowel movement? I'm like, oh my gosh, if I have gas, I'm screwed. Literally I'm in an ambulance right now and I have gas or I'm constipated. That's a great story. My mom will love to tell that one. So will my husband. So they get me there. They get everything. My doctor comes in and he says, you're in a lot worse shape than probably 3/4 of my patients here at Mercy Hospital. I said, oh, okay, well, I just hope I'm not constipated. He said, I've ordered you a lot of pain meds, extra pain meds, so make sure to use them. I'm not joking you. Every 3 minutes I was asking for a morphine shot. And it didn't even touch me. Couldn't even feel a difference. My husband walks in and he's just, he's on his phone. He doesn't even know how to cope because all I can do is just twist and torch and scream in this room. So the doc comes in and he's like, okay, we're going to get a CAT scan and ultrasound. I'm pretty sure you've got gallstones. That's kind of what we're thinking. Okay, we don't know anything better. So Luke is looking that up online. I'm screaming, trying to figure out how to get in the best position. They take me off to ultrasound or CAT scan first. And I'm thinking, these ladies think I'm nuts because here I am going, freaking out about this invisible pain. They gave me through my test, ultrasound. This woman is making me twist on my side, and I'm literally about to pull her own hair out. She's like, just hold still. I'm like, I need meds. I thought I was going to hurt a nurse. I didn't. But it was so much pain that I couldn't even control it. As I was getting rolled back to my room, and I mean, the test went really quick, I see my doctor waiting across from my room. And I thought to myself, he's waiting for me. There's something. He's waiting for me. And I just had a gut feeling. They turn me into my room and he immediately follows. And he grabs a stool and my husband's sitting at the end of the bed. And he sits down next to me and he goes, Katie, it's bad. And I said, okay. And he said, it's really bad. I don't know how bad, but it's really bad. What's going on is you have some sort of perforated ulcer in your system, and all of your stomach acid is in your small and large intestines right now. We can see the acid and the gas on the CAT scan, and it's eating away at your insides. That's why you were in so much pain, because it just keeps eating away. He said, I don't know how bad it's going to be, but you're probably going to be under for 5 to 7 hours. You may wake up bagged, which means that you would have colonoscopy bag and I would be pooping in a bag. He said, we're going to dissect your bowel sections. We'll try to save as much as we can. He said, you're looking at, I'm thinking my 4.5-year-old in work, all that. What's my recovery time? I think is the only thing I blurted out. And he said, you're looking at least 8 weeks. This is going to be hard. And I just remember thinking, this is bizarre. Like, something really is happening here. And he said, I've been on the phone with our trauma surgeon, and he's scrubbing up right now and setting up the surgical team. You're going in right away. I remember briefly seeing my mother, and, moms are frantic because at that point Luke had called her and said, you need to get here. It's serious. Because we thought it was something dumb. And so somebody had gotten to my house to watch Vivian. My mom had gotten to the hospital and she's running, trying to see me and figure out what's going on, and nobody knows. We didn't even know. And she said, which I find really interesting, is that the last thing she remembers me saying is they wheeled me into surgery because my husband went with. And he doesn't remember a damn thing because he was so traumatized, I think, by it. But she said I was screaming for them to put me under. I was just begging them for them to put me to sleep. So obviously I was in a ton of pain, right? The next thing I remember is I woke up in recovery at, I think, 2 a.m. And my mom said she walked into recovery with my husband and my sister-in-law, Chris. And she said, how do you feel? And I put 2 thumbs up and I said, I feel like shit, but better than before. And I guess, I had just been under anesthesia. So I wake up with a tube in my nose, catheter. I've got, all of these lines in. And my abdomen, I can't move a muscle because it's painful. And I'm on a ton of drugs, right? They show me my Dilaudid button. Okay. And so the doctor talks to me, and I barely remember kind of what was going on. But he said, it was a good case scenario. You had a perforated ulcer, which means that it's an ulcer that had been there for a while. And for some reason, something had burned through it. And it was probably an autoimmune disease drug that I had been taking for lupus. And on top of that, steroids, because I had a discoid lesion at the time. So it was a normal regimen for me, but it had irritated my stomach and I hadn't even known better. Or taking too much ibuprofen and then stress on top of it aggravates all of these things that create these ulcers, and then they perforate, and then he said I had 15 minutes before I wouldn't have walked on this earth. So they get me to my room after a little bit of recovery, and they move me from my surgical bed to my hospital room. And they didn't do kind of like, it's not a perfect slide, right? So there's a little, like an inch drop. I dropped. An inch, it's not like they're dropping me a mile. And I remember screaming because I thought my body had just been ripped into a million pieces. And I didn't even understand at that point what the pain looked like. And a nurse came in and said, we need to look at the wound right now. And so she opened my gown up and unwrapped this bodyguard. And there's a 12-inch incision on my abdomen. 12 inches. From under my sternum to 2 inches under my belly button. And I'm looking at it going, I don't even know what I expected. Maybe laparoscopic? I don't know. But unfortunately, they had to pull, fortunately, I should say, they had to pull everything out to check, to make sure that it wasn't dead or, eaten away. And then they had to clean it and flush it out and then re-put it back in. And I'm thinking, I had a baby. I have stretch marks, and this is, the line goes, I'm sure you guys have seen pictures, goes like kind of around my belly button, I'm like, this is, and, everyone's saying, oh, it's a beautiful scar, he did so well, and I'm thinking, I've got a 12-inch incision on my stomach, I'm 30, what just happened? And I shut down at that point. I had just had a breathing tube in for a while, and an NG tube. I had a catheter in, so I couldn't eat for 4 days because they needed my stomach to heal. So they would let me have a popsicle every 8 hours, and then they would suck it back up through my NG tube. It was really hard for me to talk because the NG tube was all the way down to my stomach, and I had a breathing tube in for the surgery, so I had the both of them rubbing is really irritating in your throat. I couldn't move either way, and how hard is that for 4 days straight? Because my ulcer was my incision was so painful that I, just even trying to sit. I had to have 2 people to walk with me. I had to have a band. I was on the geriatric floor pretty much, because I had to learn how to walk again. My sister-in-law stayed with me. She's a pediatric nurse, so she knew what I needed, because at that point I shut down. There was no understanding of what was going on for me. I've been in this hospital bed with a 12-inch incision at 30, looking at all of these people who are changing my catheter and injecting me, with heparin shots in my, arms, and my legs are being massaged because they're worried about, ulcers, and my husband's crying, and my mom is looking at me like she's just, ghost, and my sister is the strong one, and just, whatever you need, we've got it, it's okay, and I'm sitting there thinking, what the hell just happened? And so that's the start of the surgery. So I'm going to take a break for a second, just to kind of pull myself together, because that's, if you can think about being in that place, which I don't even think I remember it fully because I was so drugged, but I distinctly remember thinking, it's 2 a.m. I'm in a bed with this incision and all of these bags, and I can't even pee myself. I can't stand. I can't move. It hurts to breathe. Where do I go from now? And what the hell just happened, and why? And what about my 4-year-old? And where do I go from here? So that's the start of day 1, July 1st, 2018 for me. July 2nd, technically, because it was 2 a.m. And day 2 started the next day.